The Health Department in Gauteng is on a food and health awareness campaign following the death of 2 pupils in Soweto. The children fell ill after allegedly eating biscuits allegedly bought at a local shop. We're now joined by Motalatale Modiba, Gauteng Department of Health spokesperson. Thank you very much for your time this afternoon. Perhaps let's pick up on the story of the deaths in Naledi, Soweto. What do we know in terms of official results from the post-mortem? Are they out as yet?
The results are not yet out, and those obviously the police will be able to pronounce on that. I'm not sure if they're going to announce them publicly or what, but because there's currently now an inquest, they're investigating this particular case, so they would be the ones that probably manage that particular process. But what I do know is that the results are not yet out as yet. It's part of the process that is currently being embarked on with the police.
Fair enough. We understand, according to reports, that 2 more children have died from apparent food poisoning in Gauteng. Is this something that you are able to confirm for us?
Yes, we can confirm that yet another unfortunate incident of food poisoning, which occurred yesterday. 4 boys aged between 2, 3, 4, and 6 years apparently consumed sweets and chips from a vendor at Westdene in Western area in the Westdene, which resulted in, unfortunately, 2 of the boys demising on arrival when they were taken to Beggersdal CH Community Health Center. The 2 boys were declared dead on arrival. The other 2 boys were since taken to transferred to the Gauteng Hospital for observation and further management. And of course, obviously, we dispatched our team to go to the families in terms of counseling there, but also to continue with the awareness drives that have been taking place in the various areas where we've had this challenge.
Tell us a little bit more about the awareness drives. What do they entail?
Look, on a regular basis, as part of the environmental health team and the work that we do in communities, we have a drive where we go to communities, we educate them on issues around safe food to consume, how to prepare their food, the issues around hand hygiene, but also we go into the shops nearby where we're able to then look at issues of inspections in terms of whether the food that is on the shelves is not expired, whether there's correct labeling and so forth. That is a campaign that we don't do on our own. We work closely with municipalities because you recall that the issues around inspecting of these particular facilities, including even licensing and so forth, is something that is handled at the local level. But because in the Gauteng Health, we've got a program called Taking Health Services to Teach Communities, that is your townships, informal settlements, hostels, and so forth. When we go there, we go as part of a holistic campaign. I know that we've been to areas like Gauteng Springs, we've been to even the Westdene, we've been there before, we've been to areas in Johannesburg. So what the current situation is pointing to is basically indicating that there is a need to intensify those particular efforts because communities obviously are still falling vulnerable to some of the persisting circumstances where they are. But there's efforts working with various municipalities to ensure that we ramp up the education and the awareness within communities, especially insofar as the issues of buying food from vendors or shops that have got valid certificates of acceptability. You know that when you go to these places, those certificates must be displayed or produced in line with the relevant regulations. And those certificates are issued by your local municipality. So we then educate the public around those in terms of what to look for, especially when they are buying food, in terms of the food labels, the names of the products, and just the labeling, just generally, that shows you when the food is going to be expiring and what are the ways in which food can be kept safe. We're now entering into a summer period where the temperatures are a bit hotter and therefore food will obviously get spoiled much quicker. And those are some of the things that we would obviously want to emphasize when engaging with communities in terms of how to keep their food more safer, the protocol that they need to follow, especially when it comes to hygiene issues.
You mentioned expired food. Does expired food cause death?
I would not be able to say expired food cause death, but we obviously want to minimize the issues of people consuming food that is perhaps not healthy to consume. Remember that you and I sitting here, we would not conclusively be able to say that, because it will depend. I mean, if something expires today and I'm eating it on the same day, I don't know how long that food would have been prepared and all of those things. But the issue is that the general messaging that we're giving to communities that do not buy food that is called mold only, that is fermented, that is colored. We generally would say then that food must be adequately labeled, meaning that you must be able to see the sell-by date on it. You must be able to see the use-by date on that particular food. You must be able to see as to, in terms of the best before, every food item will have a label that tells you that. And we're saying to communities, if the expiry date has passed, it's better to err on the side of caution and really not consume food that might be expired, or maybe you buy that it's already opened or unsealed, because then the integrity of the product that you're going to be consuming cannot be verified, because already there's a breach in terms of the protocols that are supposed to be there. And we also then say, even the issue around the hygiene, check where you're buying your food and so forth. If it's not a clean environment, it's not hygiene, you need to be extra cautious, because you might then find that you are exposed to other bacteria and so forth. So it's important that we, from an awareness point of view, we keep on raising this particular awarenesses, and especially if you look at these two incidents that we're having now of small kids, where there's allegations that they would have gone to some shops and bought some items. I think it's important as well, even at homes, that we were careful about where our kids buy their items from and what exactly are they buying, and that we conscientize them as well, so that they don't just buy from anywhere, and maybe we're able to, where possible, intervene as parents to ensure that, or guardians, to ensure that kids don't find themselves buying food or consuming things that are maybe harmful to them, as we have seen in these particular cases.
Is that enough, right? So you speak of inspectors that go into specific communities, and those communities that you speak of will have spaza shops, will have an auntie at the corner that is selling sweets, things like that. And so when you speak of a clean and hygiene environment, is that then not where you as a department come in when you send inspectors? Do we have enough inspectors in Gauteng, to your knowledge, the Gauteng that you mentioned or manage? Do we have enough inspectors? Do they come out to these communities enough, not when incidents of death occur, but before they occur, to take a look at these spaces, to see whether they are indeed clean, safe and hygienic for people to buy goods from?
Remember that, as I explained, that this process in terms of the licensing and the issuing of certificates for the vendors and so forth, it's something that is managed at a local level in terms of your local municipalities. But of course, we work jointly with them, and there are continuous efforts to actually monitor, raise awareness. And by the way, when we go to communities to raise awareness, we're not just targeting just raising food to communities only. We also engage with the teams that are going there. They also engage with the shop owners themselves to also conscientize them on the measure that they need to put in place to ensure that they are able to provide food that is good for human consumption. So it's a two-way traffic in terms of conscientizing the buyer, but also conscientizing those that are selling. But there are other, obviously, arms of the state that also play a key role. We've seen in the past with the work that would have been done by the community safety cluster, where they will go in and confiscate where they find that people are selling expired food or food that is not fit for consumption, or even goods that are not actually supposed to be sold in those particular areas. The efforts in terms of saying, is it enough? I don't think we at this stage we can say it's enough, because the issues of awareness, they also talk to issues of behavior change as well. So it's a continuous thing that we need to work together with as various sectors and spheres to continue that we continue to raise awareness. But also there's an issue of enforcement of bylaws at the municipal level, where these bylaws are supposed to be implemented. So I don't think that we can say it's enough, But I think we need to ensure that we do more in terms of raising awareness, not taking away as well responsibilities from ourselves as the public, in terms of we have the responsibility to, first and foremost, our health is our number one priority for all of us, and therefore there's also that element of us taking responsibility. As a parent, I would want to know where my kids are buying their chips, their biscuits, and all of those things, and to satisfy that indeed they're buying at a place that I'm comfortable with. So I suppose that in this particular instance, we have a tragic incident where lives have been lost. But we need to continue doing more in terms of raising the awareness, just to ensure that we have much more safer spaces. So the work is out there that needs to be done, and I think it requires all hands on deck.
Right, or catching it before it actually gets onto the streets or the shelves in particular spaces. Very quickly for us, what is the temperature? What is it that your inspectors are hearing when they go into townships, for instance? Because you'll hear people saying, well, there's specific spaza shops where people sleep on bread or or things like that. Is that what you have been finding, or is it just a misconception? Because there's so many things that are going on the ground. To your knowledge, is that just a misconception, or is it something that your inspectors have come across?
Look, I don't want to commit to that. I have not actually asked that particular question in terms of what is it, but we do know that communities are raising a wide range of issues, and part of the issues is that the law should be implemented in a more stricter way to ensure that only those that are licensed and that have got proper accreditation are able to trade in those particular communities. And that's something that we're emphasizing. And we're saying even communities themselves, they can also exercise their power in terms of their buying power to ensure that you don't go and buy when you are in an area where there's more 2 or 3 places where you can actually look at in terms of buying. Use your buying power to be able to influence change as well, to ensure that ultimately you get goods that you're satisfied with. So it's a continuous effort of educating both those that are selling and those that are buying.
Gauteng Health spokesperson Motalatale Modiba, thank you very much for your time this afternoon.